everyone, I'm Dr. Namrita Sandhu, and today we'll talk about the menstrual cycle, menstruation, and demystify some of the myths around it. First and foremost, we need to understand that menstruation is a natural and physiological process that marks your transition from a young girl to a woman, just like your mother. Periods are a natural and healthy part of a girl's life, and it should not get in the way of exercising, enjoying life, and having fun. Periods are just a natural way of your body telling you that the body is ready to make a baby. Now, what is a menstrual cycle? To explain it in a very simple manner, what we need to understand is that every woman has an organ called the uterus, which is where the baby grows. Every month, the ovaries release one egg, which gets transported through the fallopian tubes inside the uterus. Now, what happens is, once the egg is released, the uterus starts to prepare itself. The inner lining of the uterus begins to thicken in anticipation of the baby. Now, once the egg is released, it gets transported through the fallopian tube. Now, if in that time the egg gets fertilized by the sperm, it becomes a fertilized egg and it gets implanted in the uterus and the baby grows there. Now, if the ovum does not get fertilized by the sperm, the inner lining of the uterus is no longer needed and it gets shed off along with the ovum or the egg as the menstrual blood through the vagina, and that is what is called the period. Now, the first question that most people ask is, how often does a period happen? Now, normally every girl gets a period every 28 days, once a month. But just like all of us have a different height, a different face structure, nobody really has a 28-day cycle. Anything between 21 to 35 days is normal. If you get your period at a duration of less than 21 days or more than 35 days, you need to show to a gynecologist. Otherwise, anything between that is normal. And we count the menstrual cycle from the first day of your period till the first day of the next period. Now, another question that most people ask is, how long do periods last? Now, most girls typically get their periods for about 4 to 5 days, but it could last anywhere between 2 days to 7 days. Now, menstrual blood may seem a lot, but typically a girl generally loses about a quarter of a cup of blood or maybe a few tablespoons. If you have your periods for more than 7 days or you lose more than 80 ml of blood in one menstrual cycle, that is alarming and you need to show to a gynecologist. Now, sometimes it may be difficult for you to quantify how much is 80 ml of blood. If you need to use maybe 2 sanitary products in one go, maybe a tampon along with a sanitary pad, or if you're bleeding through your clothes, or if you need to change your sanitary napkin or tampon every 2 to 3 hours, that is definitely alarming. Or if you're passing clots which are more than the size of 2.5 centimeters or more than the size of a 10 pence coin, you should show yourself to a gynecologist. So then another interesting question that most people would like to know is, are the cycles regular once you start with your period? Some girls do experience irregular cycles once they start with their menses. It is basically because it's the hypothalamic pituitary ovarian axis which is responsible for controlling your menstrual cycle, and it is immature initially and it takes a few years to develop a rhythm of its own and become regular. And it also means that your initial cycles are anovulatory cycles. That means the girls are not ovulating every month, and that is responsible for the irregularity of your cycles. Another question that most people would like to know is when to expect your first period. Most girls get their periods once they hit puberty. Puberty is a sequence of events in which physical changes occur in your body. So the first body change to happen is your breast development, followed by underarm and pubic hair, and then comes your menses. And another change that most girls could observe is probably slight vaginal discharge, which could happen 6 months to a year before they get their first period. And it is a good idea to familiarize yourself with the timeline of puberty. There is something known as precocious puberty, which means puberty which happens earlier than expected. So normally you would expect breast development to happen somewhere about 9 to 10 years of age. But if you observe that your daughter has developed her breasts at the age of 7 or 6 years of age, you have to show her to a doctor. Or if the girl gets her periods before the age of 8 or 9, that is also a cause of concern, and it could mean that her sex hormones are on the higher side and needs evaluation. I hope this information was helpful for you all, and if there are any doubts, you could ask me in the comment section below. Bye-bye and see you.